think we'll get started. Good evening, everyone. We'd like to thank you for joining us for our Town Hall Youth in the COVID Vaccine with Dr. Hirji, Niagara's Acting Medical Officer of Health. My name is Angela Lorenzo. I am a health promoter on the school health team at Niagara Region Public Health, and I will be moderating during the Q&A with Dr. Hirji. Before we begin, we'd like to go over a few housekeeping rules. We have muted everyone and cameras will be kept off. You will still be able to type in questions into the chat. Please do be respectful of those in this meeting. This is a safe space to ask questions. If you have any questions you would like answered, please put them in the chat. We will try to get to as many as we can during this evening, but in the event that we are unable to answer your question, please visit our website. We are also happy to take your questions via phone or live chat. A list of resources and contact details will be available in the chat. And this session will be recorded. So I'm now going to pass it over to Dr. Hirji, who will share some brief information before we start the Q&A. At this time, again, if you do have any questions, please do type them into the chat. Okay, Dr. Hirji.
Okay, thanks, Angela. And thank you to everybody who's taking the time to join to learn a little bit more about vaccinations. And hopefully it's going to help you make the right choice for whether you get vaccinated and your child gets vaccinated. As Angela mentioned, I just want to make a few introductory comments, but really the bulk of the time today is about hearing your questions, hearing what's on your mind, and hopefully helping you to work through some of your concerns and hopefully, help you make the decision to go ahead and get vaccinated. So I just want to start off by showing you this. You've probably seen this image many times in various formats. This is what the novel coronavirus we are dealing with right now looks like. And you'll see all those little red pieces on it. Those are little proteins sticking on it called the spike protein. Under a microscope, this makes it look a little bit like a crown is on this virus, which is where the name coronavirus comes from. Corona comes from the Greek word for crown. But those spike proteins are significant because that's actually the whole point of what the vaccine does. What the vaccine does is it's training your immune system to recognize those red proteins, those spike proteins, so that if you ever get the virus in your body, it knows exactly what those are and it knows to go fight those off and prevent you from getting illness. And whatever vaccine you're getting, whether it's the Moderna or Pfizer vaccine, or if it's the AstraZeneca vaccine or the Johnson & Johnson vaccine, all of the vaccines are in various ways trying to train your immune system to recognize those red spike proteins and fight them off. So your immune system is ready in case you ever come across the virus. Now, as you all know, we've been vaccinating people for quite a while here in Niagara for a good 6 months. And these are sort of the statistics look like right now. The blue is the people who've been vaccinated in different age groups. And then the orange are the people who currently have a booking in place to get their vaccine. And you can see at the bottom of the graph, we have our elderly age group, and you can see lots and lots of elderly people have signed up for vaccinations. These percentages are based on an estimate by Statistics Canada of how many people are in that age group. And you can see we've gone above 100% for a couple of age groups, which probably means that the Statistics Canada estimate of the population is maybe a touch lower. And that's what happens with an estimate. But obviously lots of enthusiasm there for vaccinations. As you go up the graph and you get to younger groups, it's not quite as high, but of course these groups haven't been eligible to be vaccinated as long. But at the very top, you can see that our lowest groups are teenagers and then the 18 to 29 age group, where particularly with the teenagers, we're still under 50% of that group vaccinated. So there's lots more room for vaccination to happen in that group. And because, of course, there's much larger number of people who are not yet vaccinated, that unfortunately means this is a group that is continually going to keep getting COVID-19 illness in the coming months. Now, when we've heard about COVID-19 over the past 15, 16 months of this year, I think a lot of the conversation, and rightly so, has been about elderly people. Elderly people in long-term care homes and retirement homes getting very severely ill, and in many cases, unfortunately, passing away. And it's absolutely true that they have had the most severe illness of anybody through this pandemic. But I just want to show you how the number of infections in that age group, the people who are 70 and above, compares to the number of infections amongst children, people 0 to 19 years of age. So if we're looking at people 0 to 19 years of age, a little over 19% of Canada's COVID-19 infections have actually been in this age group. For almost 1 in 5 people in Canada who's got COVID-19 has actually been under the age of 20. When we look at the group that it's 70 years of age and older, you'll see it's actually less than half of that. So half as many elderly people have gotten COVID-19 as people who are children and teenagers. And I think that's something a little bit surprising because we hear so much about COVID-19 in elderly people. While it's definitely more severe in elderly people and they're more likely to be hospitalized and potentially die from COVID-19, younger people are actually more likely to get that illness. And of course, that does put them at some risk of getting severe illness as well. And if we look at the Canadian stats on this, we can see that 1,300 plus children have actually been hospitalized in Canada so far since the pandemic began. We've had 165 of those children actually end up in an ICU, in many cases on a breathing machine like a ventilator. And sadly, we've actually had 13 children in Canada die from COVID-19. And so while those numbers aren't as large as they might be for elderly adults, those are still far higher numbers than I think any of us want to see happening to affect our children. And so this is one of the reasons why we really do want to see our children vaccinated so that they can be protected and they don't have any of these severe outcomes. Now, something you've probably been hearing about in the news is this Delta variant. And what this Delta variant is, it's basically a mutation of the virus that has emerged over time. And unfortunately, what it seems like is this Delta variant is more contagious, so it spreads more quickly. And it also is more severe, so it causes more severe illness. So more people who get infected with the Delta variant are going to become hospitalized. And in the United Kingdom, this is one of the early countries that has been affected by the Delta variant. They have actually had a very successful vaccine rollout. They're actually one of the world leaders in terms of vaccination. I just want to show you what cases of COVID-19 have looked like there over the last couple of months in the UK. And you can see that over the last couple of months, they've started to see their cases of COVID-19 starting to go up quite markedly. It's actually almost about 4 times up in the last 4 weeks. And if you look at some of the news coverage coming out of the UK, it's talking a lot about how the Delta variant is really spreading amongst school children, or it's really spreading amongst young people, and that's why those numbers are going up. Those numbers are going up because young people are overwhelmingly getting sick from this Delta variant. And the reason, of course, they're getting sick is that they're the ones who are not yet vaccinated, and so they're the ones at risk of getting illness. This is another graph here that shows the breakdown of where the infections are happening. This is what's called an age pyramid. On the left side, you see females. On the right side, you see males. And each bar represents how many infections there have been in that age group. And you can see that the 20 to 29 age group is where most infections have been, but the second most infections are actually in the 10 to 19 year age group. And of course, children 12 and up are able to get vaccinated. So a lot of these infections could be prevented if people were able to get vaccinated. And that's hopefully what we'll be able to do in Canada before we have the Delta variant spreading here. And then, one other set of headlines that I think we're seeing in the United Kingdom is that on top of seeing that the infections are spreading amongst young people, is that there's this news here about the National Health Service in the United Kingdom, which runs the healthcare system, is seeing a lot of young people are unfortunately being hospitalized. The United States is taking note, and President Biden last week was talking about how this Delta variant is particularly dangerous for young people. This is another news story talking about, emphasizing the real risk for young people and how this more severe variant of the virus is spreading through young people. And, here's one other news headline hitting on that theme. And I think really today is about hearing your thoughts, hearing your concerns about vaccination, because we in public health truly believe that we don't want to see children suffering these sorts of outcomes. We want to see them vaccinated so they're protected, and we don't see the same kind of headlines that have been seen in the United Kingdom and elsewhere. And so with that, I'd like to turn it over back to you, Angela, to start answering some of the questions from the group here.
Okay, great. So our first question, Dr. Hirji, is why should I get my kids vaccinated when the adults are vaccinated?
Yeah, so, I think it's a really good question because, of course, if a child is not vaccinated, but all the adults around them are vaccinated, that creates this ring of protection around the child. So the child is at some level protected from that. But the child isn't going to be completely protected. First off is, of course, a child isn't going to just be at home around the other members of the family that are vaccinated. A child is going to be heading out the home, possibly joining the parents to go on errands, grocery shopping, the like. But they're also going to go on play dates with their friends. And hopefully later this year, we'll be back in schools and children will be back in schools around other children. And when they're around other people who aren't vaccinated, there's going to be the chance that infection could spread to them. And that's, absolutely the kind of scenario we're trying to avoid. And just because the adults and other people in their family are vaccinated, they're going to be at risk because they're back out in the community. The second reason I think it's important is that while the people around the child may be vaccinated, we know no vaccine is 100% effective. Every vaccine does have some error rate, and there's a small percentage of people who are vaccinated who still will get sick. So even in the home, if all the parents and others are vaccinated, it's possible that some of them might still get infected and bring that infection home and unfortunately pass it off to the child. And then the final part is, of course, a child is hopefully going to be once again able to start to visit their grandparents and their aunts and uncles. And if they unfortunately do get COVID-19, they are at risk of possibly passing it on to a grandparent or an aunt or an uncle. And while that aunt and uncle or grandparent might be vaccinated, there's a small chance that the vaccine's not going to work for them, and they'll be one of the people who still gets COVID-19. And we have seen how bad COVID-19 is once it affects elderly people. They get severely ill. They often die from COVID-19. And I don't think any family wants to have that happen to one of the elderly members of their family. And having children vaccinated, make sure everybody in the family is going to be as safe as possible.
Okay, great. Our second question is, why are we recommending vaccinating children when people under 20 have a 99.998% recovery rate?
Yeah, so first off, while children may have that very high recovery rate, there's still that small percentage of people who are not going to recover, particularly at the, I showed the statistics that we've had a handful of children in Canada unfortunately die of COVID-19. And I don't think anybody wants to take the chance that that is going to be their child or that's going to be a child close to them. So we obviously want to make sure children have as much protection so they're not going to end up being one of those people who unfortunately passes away. Even if they do recover, though, as I showed, that there's over 1,000 children who've had to be hospitalized with COVID-19 and a few hundred children who've ended up in an ICU on a breathing machine. And I don't think, even if you're going to recover, that's, I think, not the kind of recovery we want to see a child have. We want to see a child recover without having to go to the hospital. And then the final concern here is that while people make a recovery from COVID-19, we are seeing some people who have COVID-19 have some long-term side effects, particularly some neurological side effects. So the infection actually seems to get into the brain. And some people lose their sense of smell and it doesn't actually come back. Some people actually get this brain fog and they have difficulty concentrating and they never actually quite get back to normal. And that's obviously something we don't want to see happen, that someone might get past their infection and recover, but we don't want to see any children have these sorts of impacts and possibly end up with the rest of their life living with some of those disabilities.
Okay, our next question is, the vaccine does not prevent anyone from contracting the virus. So what is the purpose for vaccinating?
So I would say the vaccine does prevent people from contracting the virus. I'm not entirely sure what the information that led to that comment is. The whole goal of the vaccine is that it's training your immune system. So if the virus does appear in your body, your immune system is primed and ready and able to basically fight off that infection before it starts to make you ill. So it absolutely does prevent you from contracting the infection if you are out and about and unfortunately around someone who has COVID-19.
Thank you. Next question. In September, when young students go back to in-person learning, will they have to wear masks, meaning those 11 years and under?
Yeah, so I think we're going to need to wait for the provincial government to really advise us on what the rules are going to be when children go back to school. My expectation is that there's a good chance that children will still need to be wearing masks, particularly the children who are not vaccinated. But I think possibly even some of the vaccinated children might need to still wear them for a little bit longer. I'm hoping that as we get through that school year, we'll get to a point where enough people have been vaccinated with 2 doses of vaccine that masks will start to fall away. But I think there's a good chance that come September, we won't quite be at that period, and some children will still need to be wearing masks.
Will vaccination be required in high schools come September?
Yeah, again, I think that's going to be a policy decision the provincial government has to make of whether or not vaccines are going to be required. Now, I just want to highlight that the policies we have in Ontario around vaccination aren't actually requiring anybody to get vaccinated, but they're requiring you to make a choice about vaccination. So you either get vaccinated or you bring in a legal document saying that you've made the decision not to get your child vaccinated for religious or conscientious reasons. And so I think that's the kind of policy that may happen. So it won't formally be requiring vaccination, but it will be requiring that every parent has made that conscious choice of what they're going to do and reported that choice. But ultimately, it will be the provincial government who makes that decision, and we haven't heard that decision yet.
Okay, thank you, Dr. Hirji. And the next question is, what do you recommend for parents who are both fully vaccinated with a child under 12 years old with underlying medical conditions regarding returning to in-class learning in September?
Yeah, that is a really tough question. And, I think every parent is ultimately going to have to make their own decision around that. I think you're weighing both the benefits and the harms of potentially going back to school. Obviously, the benefit of going back to school is probably, I think most parents feel over the past year that online learning hasn't been as good as in-person learning. So obviously, there's that huge benefit of having a child back into school for in-person learning. Obviously, though, once they're around other people and they're not vaccinated, there is some small risk that they could get COVID-19 infection. And I think you'd need to make the decision of what is right for your family and how much risk you want to take. I think one consideration will obviously also be is how many other children who are able to get vaccinated, those 12 and over, have actually been vaccinated. So that gives you some sense of how safe the school is. How many of the teachers and other staff people have been vaccinated, that's going to make the school safer. And just the number of cases there are in the community. If there's very few cases in the community, there's not going to be very much risk of infection getting into the school. But obviously, as that number rises in the community, more cases will come into the school. So I don't want to give a blanket response of one way or the other. I think every parent does need to make their own decision based on their child. But I think those are some of the considerations to think about.
Okay. Does mRNA vaccine cause genetic modification? Is it a nanotechnology?
Yeah, so it's absolutely not it's something that is going to alter your DNA in any sort of way. What messenger RNA is, it's really the basically blueprints for your cells to make a protein. And so when you get the vaccine in you, that mRNA goes into the cells and it doesn't go anywhere near your DNA. It's sitting on the outside part of the cell. And your cell starts to recognize that, okay, there's a blueprint to make this protein. It starts making that protein, which is that red, spike protein I showed you earlier. And that then trains the immune system that this is a foreign protein that it needs to learn to fight off. And that messenger RNA in your body basically degrades over time. It's kind of like if you had a sheet of paper and you kept, using it and photocopying it, eventually it would kind of, fade away and need to be thrown away. And that's basically what happens to the messenger RNA. After a couple of weeks, it's broken down and it just sort of, gets faded away and your body destroys it. But what remains after the fact is your immune system has been trained to fight off that messenger RNA, fight off that spike protein, which the messenger RNA has trained it to make. On the topic of the nanotechnology, there is basically when the messenger RNA is injected in your body, it's injected with inside this kind of capsule made of lipids. And lipids are basically a kind of fat. And those lipids are developed using some nanotechnology. So that's where the nanotechnology comes in play. It's the nanotechnology to kind of create that fatty layer that protects the messenger RNA when it's injected in your body. That gets into your cells. And of course, at that point, it goes away. And actually, that lipid kind of layer is actually the same layer that surrounds all of our cells.
Thank you. Next question. I heard that people who are getting a third shot or a booster, will the COVID vaccine become something similar to the annual flu shot?
Yeah, so we actually don't know this yet. The reason we get the flu shot every year is twofold. First, that the flu shot that we got last year, after about a year, the immunity we have from it actually fades away. The second part is that the influenza virus is always mutating, and so it's mutated to something different after a year or two, and so we need a new flu shot that better protects us against a new version of that shot. With COVID-19, so far, we've not really seen the immunity from the vaccine weaken over time. Now, we haven't had the vaccine for very long. It's only been about 6 months people have been getting it, but in those 6 months, we haven't seen it weaken yet. The other part about having variants emerge, we are seeing new mutations of the virus emerge. But some of the good news is seeing that so far, if you've gotten 2 doses of the vaccine, it still seems to be very good against the new variants that are emerging. So right now, we're not yet seeing a reason why we would need to start to get annual booster shots or even get a 3rd shot down the road, but it's certainly possible. And we'll only know with a test of time whether or not immunity fades over time and so we need a booster, or if we have variants that emerge that the vaccine doesn't protect us against. And so we're going to need a new kind of booster that helps boost our immunity against those kinds of variants. So time will tell, but right now it's not looking like we're going to need that within the next 6 to 12 months.
Can we talk about kids getting myocarditis? What is the percentage of kids possibly having this issue?
Yeah, so myocarditis is actually something that does occur naturally for other reasons aside from vaccination. It's basically inflammation of the heart, which absolutely does sound scary, but the good part is that in children almost always recover without really any kind of treatment needed for it. Many different infections will cause myocarditis, and actually COVID-19 infection will cause myocarditis itself. What we've seen with the vaccination is that a small number of people do seem to then have myocarditis in the weeks after vaccination. And what we're not sure is that this just the natural myocarditis that would have happened anyway, and it's just a coincidence that it's happening similar to time that children have been vaccinated, or is this something that is actually being caused by the vaccine? In the province of Ontario, we've had 6 cases of myocarditis in people under 20 years of age out of over 500,000 children who've been vaccinated. So you do the math there, it's about 0.001% of children who've been vaccinated have had myocarditis, but we're not sure if those have actually been caused by the vaccine or if they were just coincidentally around the time someone got vaccinated. And these were children who would have had myocarditis anyway, because myocarditis is something that happens. One thing to flag is that the risk of getting myocarditis with COVID-19 infection is actually a lot higher than it is of getting it after the vaccine, it seems. So that's something also to keep in mind.
Okay. With regards to the myocarditis events seen in youth, is there a possibility of just 1 dose being enough for teens?
Yeah, right now we don't have any research saying that. Now, we haven't done a lot of research studies looking at 1 dose in teens versus 2 doses in teens. So I don't know if we can be absolutely certain about this. But what we are seeing a lot of research, especially out of the United Kingdom, showing is that with the Delta variant, 1 dose gives you about 30% protection. 2 doses will give you 90% protection. And so at least when we look at the population as a whole, it seems really important to have 2 doses of vaccine to make sure you have protection against that Delta variant. We assume that if it's the case for most of the population, it probably is going to be the same for teens, but I don't think we can know that absolutely for certain. As more research emerges, we probably will have a better answer to that. But right now, my recommendation would be to get both doses of vaccines to make sure your child does have protection against that Delta variant.
Okay, great, thank you. The World Health Organization is not recommending children get vaccinated. How is Canada approaching this?
Yeah, so I think if you actually look at the World Health Organization's websites, it talks about how most vaccines are not recommended for children, but they do actually have a statement there saying that they've reviewed the Pfizer-BioNTech vaccine and decided that the Pfizer vaccine is safe and effective in children 12 years of age and up, and children at risk of COVID-19 should be vaccinated with it. And then it's up to, of course, national policy of what you go around doing that. I showed you earlier that almost 20% of the infections of COVID-19 in Canada have been in people under 20 years of age. So definitely a lot of children are getting infected with COVID-19 here. And sadly, we've had children hospitalized in ICUs and unfortunately passed away from COVID-19. And so, I think that policy that's come up in Canada based by the National Advisory Committee on Immunizations, which are the national scientific experts in vaccines, is that we do recommend children do get vaccinated here because we are seeing a lot of infections in children, and unfortunately seeing a handful of children have really bad outcomes, and we want to prevent those.
Okay, next question is, how are adverse effects being recorded in Niagara?
Yeah, so anytime someone has an adverse effect from a vaccine, so any kind of, unusual occurrence after you've been vaccinated, whether it's linked to the vaccine or we're not sure, maybe it might be linked to the vaccine or not, we do get a report to us in public health. So what we advise you do, of course, if you have anything like that, is talk to your healthcare provider and they will submit a report to us in public health. We take that report, we investigate it, we may call you up to get a little bit more information, and then we make sure this gets entered in a provincial database. And then this information gets collated at the national level, and then even actually at the global level. And so we start to look for patterns in that data to see, is there a pattern of certain adverse events that keep emerging? So for example, talking about the myocarditis, in the United States and Israel, they do something very similar, and they started to see the myocarditis. And then in Ontario, we can now see that there have been 26 cases of myocarditis, 6 of those in children. And so we start to see, there's some signs that something could be happening here, and we're able to keep following this and eventually make a decision of, is this being caused by the vaccine or is it just a coincidence unrelated to the vaccine? And also seeing what happens to people with myocarditis. So far in Canada, fortunately, everybody who's had myocarditis has gotten better and made a full recovery. And so that's, of course, a really important piece of information as well, if we ever did find myocarditis was linked to the vaccine, to make sure it's something that people are getting better if we continue to need to make a decision if we're going to keep vaccinating or not.
Okay, thank you. What options are available other than vaccination?
Yeah, so vaccination, of course, is going to train your immune system to fight off the virus you ever come in contact with it. If you're not getting vaccinated, you really don't have any other option for boosting your immune system in that way. We've not really found any sort of medication or the like that will do that. A vaccine is really the only option for that. So at that point, it really becomes about making sure you limit your exposure to the virus and limit your child's potential to be exposed to the virus. And that starts to, go to what we've been doing so much over the last 15 months. Keeping 2 meters distance from people is going to limit your potential to come in close contact with the virus. Wearing masks is going to protect you from coming in contact with the virus. Avoiding public places, avoiding crowds, avoiding social interaction and, visiting with friends and extended family and the like. All of those become the kinds of things that we need to keep doing to protect ourselves so we don't come in contact with the virus. The hope with getting vaccines, though, is that we'll build strength in our immune system so we can actually start to see our friends and we can start to see our extended family and we can start to go back to public places, we can go back to schools, and we'll have that vaccine protecting us from infection. And so we won't need to do some of those and we'll be able to start to return more to normal. But that it's really your option if you don't choose to get vaccine is to really double down on all of those other things to avoid other people so you don't get infected.
Okay. Would the COVID vaccine interfere with other vaccines that my teen has to have?
Yeah, as far as we know, the COVID-19 vaccine does not interfere with any other vaccines. As a precaution, we do recommend that you space out getting the COVID-19 vaccine before you get any other vaccine. And so usually you'd want to wait about 4 weeks after that. As I talked about, that messenger RNA that gets injected in the body, after a couple of weeks, it basically breaks down and your body gets rid of it. And so if you waited 4 weeks after a vaccine, you're not going to have any more of that around, and so you're going to be safe.
Okay, thank you. Would it be worthwhile to wait 8+ weeks for getting dose number 2 for teens? Would there be any potential benefit in waiting versus getting it sooner?
Yeah, so this is a really interesting question. And I do think there is some benefit to waiting a little bit longer between doses of the vaccine. What we actually know with really every vaccine we've ever developed in Canada and around the world, and we've actually seen this to some extent about COVID-19 vaccine, is that when you space out the time between 2 doses of vaccine, you actually end up with stronger immunity after that second dose, and you actually end up with immunity that's probably going to last longer. So that's probably going to happen if you space out your COVID-19 vaccine. If you get it at 8 weeks interval instead of 4-week interval, you're probably going to get stronger immunity at the end of those 8 weeks, and you're going to get immunity that lasts longer. The flip side of that is that, of course, because you've delayed those extra 4 weeks, you're not going to get full protection from the vaccination as early. So you will go about 4 more weeks where you're not going to get the benefits of that second dose. And so that's a trade-off. If you're really worried about getting infected in the near future, you probably want to get that second dose earlier. If you feel there's not as much risk of getting infected in the near future, and maybe you want to make sure you maximize your infection in the long term, I think it's very reasonable to wait a little bit longer to get vaccinated. And the good news right now is that you could do an 8-week interval between tier 2 doses and still have someone with both doses before they start school.
Thank you. What is the rate of serious illness from COVID for under 18 age group for original strain and Delta variant?
Yeah, I don't know what the exact percentages are. You know, I showed you the stats earlier, so it's close to probably, I'm just actually going to look back at my numbers here. Yeah, so it was about, about 275,000 children in Canada have had COVID-19. Of those 275,000 children, we had about 1,300 children have a severe illness and be hospitalized. So that's, maybe 0.4, 0.5% of children, unfortunately, ended up being hospitalized. When we look at the Delta variant, it looks like it's probably about close to 50 to 100% increase. So 1.5 to 2 times more likely someone is going to have a severe outcome. So what that would mean is that instead of having 1,300 hospitalizations, we would have maybe closer to 2,600 hospitalizations amongst children. So you're looking at up to double the risk of severe outcomes with the Delta variant.
Okay, I'm likely going to pronounce the next one wrong, but I'll give this a try. Why aren't we using hydroxychloroquine? The CDC says it's completely safe. We carry the drug in local pharmacies, so why not study its use against COVID-19?
Yeah, something's gone wrong with my video here. Oh, they're right back.
You're back.
So hydroxychloroquine was a drug actually at the start of last year, which we wondered if whether or not it would protect from COVID-19. And what actually was happening in the early months of COVID-19 last year is people were getting severely ill in the hospital and they weren't getting better. And doctors basically just started to take cocktails of all kinds of drugs and give it to patients in hopes that they might get better. And some of them did get better, and many of them had hydroxychloroquine. And so we started to wonder, was the hydroxychloroquine making them better? Or is it just a coincidence and they just actually got to the point where they actually started to improve and it was just a coincidence they got the hydroxychloroquine? So a whole bunch of research studies were actually done last summer on hydroxychloroquine. And unfortunately, what we found is hydroxychloroquine didn't have any benefit in terms of improving people getting better after COVID-19. We did clinical trials where we had one group who got hydroxychloroquine, another group didn't get hydroxychloroquine, and there was no difference in the percentage of people who got better or reduced their chances of being hospitalized in those two groups. And so we've recognized that hydroxychloroquine, unfortunately, is not the miracle drug that's going to protect us from COVID-19. And unfortunately, hydroxychloroquine is a relatively more dangerous drug. It has more side effects, particularly side effects that can actually cause your heart to become ill, to get heart failure, potentially have your heart stop. And so those are really severe side effects that we wouldn't want to give to anybody.
Okay, will the vaccine affect fertility in females and males?
Yeah, the concern around fertility for vaccine has been floating around on the internet, and I think a lot of people are quite concerned about it. There doesn't seem to be actually any scientific basis to that. There's no scientific studies that have seen any evidence that infertility or difficulty having children after being vaccinated is arriving with a COVID-19 vaccine. It seems like it's a rumor that started on the internet without any scientific basis. The one thing also we know around fertility is that, we have an 80-year track record of developing vaccines, and for 80 years, we haven't really seen any vaccine that has an effect on someone's fertility. That doesn't seem to be the kind of side effects that we see with vaccines. And so there's very little reason to think that we would see any sort of fertility issues with the COVID-19 vaccine. The things we worry about COVID-19 vaccines are really, of course, at the place you get the injection, you're going to have pain, you're going to get a redness sometimes, there's going to be a rash sometimes. We know allergic reactions are quite common after the vaccine. Some people get, muscle aches and fatigue a little bit for a few days after the vaccine. Those are the kind of side effects that we're seeing a lot of with the vaccine. The allergies may be a little less so. We haven't seen any evidence that people are having fertility issues.
Next question. What is the expected time frame for under 12 to get the vaccine if Pfizer presents successful trial results in September?
Yeah, so both I think Pfizer and Moderna are doing some research studies to get vaccines approved for children under 12, and they'll end sometime in the fall. So I think if the studies were done at sometime in September, I would imagine probably end of October, sometime in November, they might actually be licensed for children. Health Canada would obviously want to very carefully review the data to see what it shows to make sure that we're absolutely certain that the vaccine is safe for those younger children, but also still effective against COVID-19 for those children. Only after they've done that review that would take place. So I would imagine that would take at least a month and possibly 2 months. So my thinking is it's probably by the end of the year, hopefully we'll have a vaccine ready for children. And maybe in December, we might be in a place where parents who want to get their child under 12 to get vaccinated will have that opportunity.
Okay, can you tell us about the COVID-19 vaccine trials?
For sure. So vaccines actually go through multiple phases to get approval. So this will take a couple minutes to really explain. Obviously, first off, you do some studies really inside test tubes. You have cells outside of the body, you present them with the vaccine, you see how the cells react to the vaccine, you present them with some of the virus to see how the cells react to the virus. And once you've proven that the vaccine looks like it's working in those test tube studies, you move on to a phase of actually doing tests in animals. And so you're taking animals such as mice, injecting them with a vaccine, presenting those animals with the virus and seeing how that works. If it looks like the vaccine is working in animals and it's safe in animals, you then actually progress to starting to do some very limited trials in humans. And these are called phase 1 trials. Usually you're looking at 10, 20 volunteers sign up to get the vaccine injected in them. And then we watch to see what happens. And we're really here looking out for safety. That does the vaccine look like it's safe? Any side effects when these people get the vaccine? As well, can we measure antibodies being created? Is the body starting to produce immunity for the virus based on that? If it looks like it's working on this small number of people, the 10 to 20 people, we then progress to what's called a phase 2 trial, where we actually recruit a few hundred volunteers and we provide the vaccine to a few hundred volunteers. And here again, we're going to look for any signs of safety issues with the vaccines. If you're injecting only 10 or 20 people, you're not going to see a problem that's a side effect that only arises every 100 people or every 200 people. So now with a few hundred people vaccinated, you can start to see that. And again, you're going to see what antibody levels they produce. You're going to see how many people actually get infected with COVID-19 to see if it's working. And if it's working at that phase 2 trial, you then proceed to the big trials, which are the phase 3 trials, where they have tens of thousands of people, usually recruited across the world, so in multiple different countries. And what you'll do is actually you'll have 2 different groups in these trials. You'll have tens of thousands of people who get the vaccine and tens of thousands of people who don't get the vaccine. And they'll get a placebo or they'll get a totally different vaccine, like a tetanus booster. And then you're going to follow those 2 groups over time to see how many people get COVID-19 illness and compare, is the group that's vaccinated getting illness much less than the group that didn't get vaccinated. You're also going to look for any evidence of side effects, because now that you're vaccinating tens of thousands of people, a really rare side effect that maybe only happens every 1 in 1,000 or 1 in 10,000, you're able to start to pick those up. And then once you finish that phase 3 trial, you've got the data, that then goes to Health Canada, who reviews that data carefully and makes a decision of whether or not this vaccine is safe and it's effective and whether it's safe to start using in Canada. And so that's what went through with the clinical trials for the vaccines. We first did it amongst adults because, of course, we don't want to be testing anything yet on children, and adults volunteered to be in these studies. Once the trials showed that they were safe in adults and the vaccines were licensed in adults, another round of trials was done with the elder children. So those are the children aged 12 to 17. And of course, the Pfizer vaccine's now been licensed, and it sounds like possibly the Moderna vaccine will be licensed for that adolescent group as well. And so the next range of trials is now with children under 12 years of age to see if it's also safe and effective for them.
Okay, building on the last question, was a blind placebo used or was it tested against a different vaccine?
Yeah, it was tested against a different vaccine. I believe it is a tetanus booster that was used, but I'm not 100% certain about that. I don't exactly remember. But the idea was that you had one group who was vaccinated with COVID-19, another group vaccinated with, I believe it was tetanus, and then watched over the course of several months how many people were getting COVID-19 in each group. And actually, with both the Pfizer vaccine and the Moderna vaccine, we saw is about 95% fewer people got illness in the group who was vaccinated with COVID-19 vaccine versus the group who got the other vaccine. As well, we saw that there's actually 100% of people vaccinated with the COVID-19 vaccine didn't get hospitalized if they got COVID-19, whereas people were still getting hospitalized in the group that obviously didn't have the COVID-19 vaccine. And I believe the two groups were blind to which vaccine that they got, but they both did get a vaccine.
Thank you. My child has a fear of needles. How should we prepare them to get vaccinated? Are there private areas in the clinics if they aren't comfortable around others?
Yep, absolutely. So we have some private areas for people who feel that they need that privacy. So we'll absolutely accommodate that. When you arrive at our clinics and you're checking in, please just let the person know that your child needs a private space to be vaccinated. We'll absolutely make arrangements and make sure that they get that private space. We actually have been part of a research study here over the last few years in Niagara, where we actually helped study a whole bunch of techniques to actually help reduce some of the anxiety and the fear of needles. And so we actually have nurses trained with a lot of different techniques to help take a child's mind off the needle that they're getting, to help them relax, to hopefully make the vaccine the most pleasant experience possible. My advice before the appointment for the vaccination is to try and make sure that your child doesn't think too much about the needle part of the vaccine. That's obviously the worst part about it, but more to think about, what are the benefits of vaccines, how much, they're going to be able to, after they're vaccinated, get to a point where they can start to see their friends and play with their friends more and be back in schools, and really try to keep, all the positive parts of the vaccine front in mind. And then when you get to the clinic, check in, let the nurse know that you want your child vaccinated in a private space, and let them know that they might have some fear about needles, and the nurse is going to make sure to employ all those different techniques we have to make sure that they're as calm as possible.
Thank you. My child has COVID-19. Should they still get the COVID-19 shot?
Yeah, so I'm sorry to hear that your child ended up getting COVID-19 illness, and certainly hope they make a full recovery from that. What we see is that with some illnesses out there, sometimes vaccines actually provide better immunity than the immunity you get from natural infection. Diphtheria, which is a childhood illness, is actually one example of that. HPV, the infection that causes cervical cancer, that's another one where actually getting vaccinated is going to give you better immunity than just getting the infection yourself. And some of the evidence around COVID-19 seems to imply that, yeah, with COVID-19, getting the vaccine is going to give you better immunity in the long term than having had the illness, particularly against new variants. If you weren't infected against one of the new variants like the Delta variant, the vaccine is going to give you better protection against that Delta variant. So the recommendation is absolutely that even if you've had illness, we do recommend you still go ahead and get vaccinated to make sure you get the best possible protection and have the least possible risk of getting the COVID-19 illness again in the future.
Thank you. Can my child bring something to distract them while getting the shot?
Yeah, absolutely. We're very happy for a child to bring something that's going to help them stay distracted and make that vaccination experience earlier. As long as it's not somehow interfering with getting that needle to the child's arm, we're happy with whatever your child is going to do.
Great. My child suffers from allergies. Can they still receive the vaccination?
Yeah, the vast majority of allergies should not be a concern for getting vaccinated. Right now with the Pfizer vaccine, there's only actually one known chemical inside it that causes allergies, and that's called polyethylene glycol. So unless your child has an allergy to polyethylene glycol, they are completely safe to get the vaccine, and there should be no reason for them to feel worried about that.
Okay. As a service provider in youth health/mental health, do you think we should be following similar guidelines to schools in terms of having youth in person for services? Is there guidelines for service providers for in-person and group limits / gatherings. Let me know if you want me to read that one again.
I think I've got it. Yeah. So guidelines around this would probably be set by the provincial government, and particularly the Ministry of Children, Community and Social Services. They would probably set any guidelines there. Generally, for a service provider, the gathering limits aren't going to apply. Gathering limits are really for social gatherings. When someone's receiving an important health or social service, those gathering limits aren't as relevant. Obviously, we want to try and operate services in a way where we keep physical distance, we space people apart, we have as few people in the space as possible so that we can limit the risk of getting infected. So I would really look to your ministry and your regulatory bodies to what the guidelines that apply for your area are. And then if, to the extent that you don't have any guidelines, just be thoughtful about how you can operate to have the smallest crowding as possible, the most physical distance possible to keep things safe. And then I think over the course of the next few months, as we get more people vaccinated and particularly more youth are vaccinated, there'll hopefully be the opportunity to actually scale some of that back and start to return to operating some of those services in a more normal way.
Great, thank you. Similar question to before. Is it going to be made mandatory for all children to be vaccinated for school?
Yeah, so I think that will be a decision made by the Ministry of Education and the provincial government. Right now, they haven't made any decision along those lines. And obviously, I think, children from 0 to 11 will still be able to attend without being vaccinated because, of course, there's no licensed vaccine for them. For those 12 and up, I think we'll still need to wait to see what the province ultimately decides. I just want to remind everybody that the policy in Ontario for other vaccines is actually not to require vaccines per se, but to require a choice be made around vaccines. So either you present proof that your child's been vaccinated for, say, measles, mumps, rubella, or you provide a legal statement saying that you've made the decision not to get vaccinated because you oppose vaccinations. And you just need to do one of those two things. You're never forced to actually vaccinate someone against your will.
Should I be worried about long-term side effects of the COVID-19 vaccine with my child?
Yeah, so, in our 80+ history of developing vaccines in the world, we've never actually had a vaccine that has long-term side effects. The side effects of a vaccine are really very much in the short term. I talked about how that messenger RNA, when it's injected in your body, after a couple of weeks, it basically degrades and your body gets rid of it. Once that happens, the vaccine is basically gone, and so it can't really cause any more side effects. The stuff we see with the side effects we see with vaccines, as I talked about, are reactions around your injection site. You may get a couple days where you kind of feel, a bit tired, you have muscle aches, etc. And that's really your immune system revving up, and that's giving you those symptoms. You may have allergic reactions, which tend to occur, really in the few minutes after vaccines to maybe the few hours of vaccination. There's really no side effects that come on after, the first few days of being vaccinated, and no side effects then linger on much beyond that. So there's really no concern that there should be any long-term side effects. The only thing long-term you'll have is going to be immunity to COVID-19.
Can I still receive a vaccine if I don't have a health card?
Yeah, you absolutely can receive a vaccine if you don't have a health card. Anybody who is present in Ontario is eligible to be vaccinated. If you don't have a health card, you can, of course, go to a pharmacy, you can go to your primary care provider, and they'll be able to vaccinate you. If you want to go on the online portal to register an appointment, unfortunately, it does require you to have a health card. So what you actually need to do is give us a call in public health. And what we'll do is we'll provide you this number that you can use in place of your health card number. And once you have that number, you'll be able to go in the provincial portal, enter that number. It'll be tied to your identity, and then you'll be able to pick whichever clinic you want to go to get vaccinated. Any one of the different public health clinics around the region, or the clinic run by Niagara Health at the Seymour Hanna Arena in St. Catharines.
Okay. Next question. What do we know about dosages for youth? Will they get the same dosage that is given to a much larger adults?
Yeah, so for children 12 years of age and up, right now the dosage of the vaccine is the same as the dosage that adults receive. The dosage is actually 0.3 milliliters. So if anybody does cooking, you know what a milliliter looks like. Say take a teaspoon, that's 5 milliliters. So you're taking basically 1/15 of a teaspoon. So it's a pretty small amount of liquid that's injected. And for children aged 12 and up, that remains the dose for them. We'll see what the dose is for children under 12 if and when a vaccine is approved for them. I do suspect that it may actually be a smaller dose once we get to much smaller children. But for children 12 and up, it is the same doses for adults, but that dose is 0.3 milliliters, so it's actually a very small dose.
Okay, great. Dr. Hirji, that actually brings us to the end of our questions today. We've gotten a lot of great questions. If we were unable to answer your questions, please reach out to us through live chat or call us. You can also visit the FAQ section on our website. Links will be shared below. Dr. Hirji, do you have a few key takeaways for parents this evening?
Yeah, so I think the first key takeaway is what you just said. If you do have further questions, please do reach out to us. We're very happy to entertain your questions and help you make the right decision for your child. Give us a call, live text us. Another great option for getting answers about vaccine questions is actually your healthcare provider. So talk to your family physician, your pediatrician, whoever takes care of your child. They know your child's health, and they'll be able to give you a really customized answer to any questions that you have. I think for me, the real concern is that, while not very many children get hospitalized or have severe outcomes, 1,300 plus children being hospitalized in Canada, 13 children dying of COVID-19 in Canada is far too many. And there's a real opportunity that we can prevent these illnesses with vaccination. And so I believe very strongly the best choice for every child in Canada who's able to get vaccinated is to get vaccinated so that they do have that protection, especially as we see the Delta variant coming, which is going to be even more contagious, which is causing even more people to get severely ill. We absolutely want to have that protection for it. So my recommendation is absolutely that, get the COVID-19 vaccine, make sure your child gets that vaccine. But of course, if you do have questions, you're not certain yet, please do reach out to us or your healthcare provider. We'll answer your questions and hope you'll be able to make the informed choice and decide what's right for you and your children.
Thank you, Dr. Hirji. Thank you to everyone for joining us tonight, and we hope you enjoy the rest of your evening. Goodbye.